Hi everyone. Today I'll be talking about data privacy issues related to COVID-19 contact tracing apps. These apps were widely used during the pandemic, but they raised a lot of concerns about privacy, ethics, and trust. So, according to SBAR, I've segregated this into four slides. We'll look at the situation first. When COVID hit, governments across the world launched contact tracing apps to help slow the spread of the virus. But this brought up tough moral questions. Were these apps tracing us too closely? Could they be misused for surveillance? Let's take Hong Kong's Level Home Safe app as an example. It was introduced to help manage the pandemic while trying to protect individual privacy. The core tension here is simple: public safety versus personal privacy. Let's talk about background. So, in March 2020, COVID 19 was declared a global pandemic. Almost immediately, countries began turning to technology. Contact tracing apps became one of the main tools for managing outbreaks. There were two main types: centralized apps, which kept information on servers ran by the government. Second was decentralized, where information kept on individual devices. Leave Home Safe app took a more privacy conscious route. It didn't use GPS tracking, didn't ask users to register, and kept all data locally on the phone, deleting it after 31 days. Data was only uploaded if someone tested positive. The fourth slide is analysis. So let's look at the main players involved: government, public health agencies, everyday citizens, and privacy watchdogs. The ethical tensions were pretty clear. One side, there's individual privacy; on the other, the need to protect society as a whole. What Hong Kong did well was transparency and control. The app was optional. It didn't track your location, data retention was clearly limited, and they even allowed external reviews of their privacy practices. The recommendation slide here says what we learn from this. First, privacy should be built into design of any public health technology from the start. That means making apps optional, using decentralized models, collecting as little data as possible, and deleting it after a short period. Governments should also provide independent oversight, be honest about how apps work, and commit to dismantling it when it's no longer needed. And in the conclusion, I would like to say the effectiveness of these apps depends on trust, definitely. If people don't trust the technology, they won't use it, right? Apps like Leave Home Safe show that it's possible to strike a balance between health and privacy. Going forward, ethical concerns must guide how we build and use technology, especially during the crisis. Thanks for listening. This is my reference slide where I took the reference from, and thank you so much.